So we're going to be doing our thoracic and lumbar range of motion testing because they're relatively same idea. The motions will be basically the same. What differs it at this point is where the therapist palpates and where he puts his hands to see the rotational component, lateral flexion component. So basically your hand will be on the spinous processes or transverse processes. But you can't necessarily isolate T from L on a basic range of motion testing. You have special tests later on to differentiate, but when it comes to range of motion testing, it won't be too much of a difference between thoracic and lumbar. So at this point, we're gonna do our regular active range of motion, passive range of motion, and resistant range of motion for T and L together. So at this point, I would like you to cross your hands over your chest. The reason we ask client to do this is very obvious actually. So when I'm actually doing passive range of motion, I don't risk of touching the breast tissue. So in this our particular example, when she does this, I'm perfectly safe and she feels safer. So please just follow the motions. As we always discuss, active range of motion, you do it yourself. So please bring your head down all the way. Okay, can you go further down? Beautiful. See, as you saw that I did a bit of a correction because sometimes you need to do that. Okay, you can come back up. Any pain?
No.
Okay, and then now you can put your hands on the small of your back, right there, and then bend backwards. Now in this case, it's a good idea to stand behind the client a little bit just in case if they fall backward or something. Any pain?
No.
Okay, you can reset. Again, cross your hands, and then please now bring your arm towards your left hip. Okay, wonderful. And then the other side. Wonderful. Okay. Any pain?
No.
Now rotate your left. Beautiful. And then rotate your right. Excellent. Can you rotate your left one more time? And rotate your right. Excellent. Okay. So the reason I wanted to repeat that is because I noticed there a little bit of restriction. Sometimes it is better to go through the motion one more time to confirm and then chart accordingly. Okay, so that concludes our range of motion for active range of motion for T and L both together. Okay. So we will be continuing with our T-spine and L-spine range of motion testing with the passive range of motion now. So yeah, just like usual, I would like you to cross your hands on your chest and I will be doing the same motions we just did for the active range of motion. So the idea is that try to relax as much as possible. Now, unique situation with T-spine and L-spine range of motion testing like this, obviously the client won't be able to completely relax like a C-spine testing or shoulder testing or elbow testing. You can't necessarily get a great result, great reading when they're already sitting this way. But the idea is to keep it as consistent as possible with the active, passive, and resistant. So you try to get as much information as possible with the passive. So please cross your arms over your chest, okay? So I'm gonna be pushing down this way now, flexion. Try to go as low as possible. Any pain?
No.
Okay, can come back up. Now I'm going to be pushing from the back for T-spine, for thoracic. You can relax. And then go back, okay, and relax. Now one thing to point out is that we're not looking for how much C-spine extension she has. So can you do that again? Go for it, Lavon just did, okay, and relax. So clients will instinctively do this. Our job is to ignore this area because we're checking for the T-spine or L-spine. So if you're doing for T-spine palpation, please stay on the T-spine. If you're checking for L-spine, please stay on the L-spine. So that's flexion and extension. So I will be putting my hand right here, okay? I'm gonna be like, so the power will be coming from my elbow. So I'm gonna be pushing this way. For lateral flexion on the left, then I will have to move. And again, I will come this way, then move, push. That's it. So just to get a better idea from this angle, my hand is actually covering the entire upper back and power is coming from the olecranon process, from the elbow, not from the wrist. So when I'm pushing down from this way So she's rotating, the lateral flexing on the left side. So in that case, I can easily palpate the T-spine, or if I'm doing an L-spine testing, I can just palpate the L-spine. Spinous processes and transverse processes. So the idea is you can put your hand, middle finger on the spinous process and index and ring finger on the TVPs to see how they're acting according to the lateral flexion. So same idea, I will go to the other direction and then push down, give it an end feel, and find out what's going on the T or L according to that. Okay, for the rotation, let's get from this, and then we're going to get from the front angle, because I would like to show what your hand is, hand position on the front. But when I'm rotating her to the left, I need to move according with the client, because if I don't move, it creates awkward situations like this one. So I need to move with the client, and my hand is on the, again, SPs or TVPs as much as possible. Same with the T or L. So same idea, I'm going to do that. So that was left rotation, and same again, I'm turning, right rotation, and give it a bit of an end feel to see how it's supposed to feel at the end. And in this particular case, tissue stretch all around, and then that's it. So that would conclude the T-spine and L-spine passive range of motion testing. Now let's get from the front and then see where my hand is holding. So as I mentioned, while at the back palpating at the front, I need to be more careful, because sometimes we focus on too much on the palpation, we basically forget the appropriate situation. So I need to make sure that my hands are solid and firm covering the front while she is putting a barrier. I've seen before that people put it way high to the point of choking the client, or way low, that this basically doesn't mean anything. So you need to make sure that you're actually holding it properly while you're doing your rotational components. And same idea. Again, rotational components. And as I said, moving is very important, because if I don't move one more time, it gets very awkward. You start staring at the client. It's funny now, but it might not be funny if it's an actual person that might not find it funny. And that, again, concludes our range of motion testing for passive. We will conclude our thoracic spine and lumbar spine range of motion testing with resting range of motion testing. So again, same idea, Jasmine. Please put your hand up like this. I'm going to be pushing from different directions, counting from 5 to 1. Just meet my pressure, please, okay? And if it hurts at any point, please instantly let me know. So this is always something, again, that I would like you to critical think where I'm pushing, what I'm testing. Okay, so if I'm pushing towards the back, the idea that if I stop pushing and let my hand go, where would she be going? So that's kind of the idea of resistant range of motion testing. So Jasmine, I'm going to be pushing from this direction towards the back. Okay, so hold, don't let me move you. 5, 4, 3, 2, 1. So I'm checking for basically flexion, okay? You can also use this, but the idea is that the reason I'm putting my hand here is that I'm checking a directional flexion. But if I put my hand right here, which you might see, when I push, I'm not necessarily checking for thoracic flexion or lumbar flexion. As you saw, instinctively, she's putting her arms down. That is more of an extension of the GH. And now it's the extension. So I'm basically just going to push you forward, don't let me move you. 5, 4, 3, 2, 1, and it's perfect. Now a common question I get asked is, Omar, can you actually isolate the thoracic spine or lumbar spine when you're pushing back and forward? My legs are moving, I'm trying to hold myself on the table. Well, you can't, not necessarily. So that's why I said at the beginning, it's not necessarily something that you can isolate TNL spine completely. Your body is going to one way or another compensate. So you try to get as much as possible information. So if there's pain in any other direction, okay. Otherwise, you move on, okay? So in that particular case, again, so when it comes to lateral flexion, right or left, one thing that is unique about this is again the same idea as I always say. If I start pushing in the mid test, where would the client be moving towards? So if I'm in this position here, if I push and I say I'm testing for left lateral flexion because, relax please, if I push down, she will go that way. So a lot of people will just come this way for claiming that they're doing left lateral flexion. But see what happens when I'm pushing. Hold, 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 hold. 5, 4, 3. And if I let go, which direction is she going to be going? She's going to be going for right lateral flexion. So I'm not testing for left lateral flexion in this case, for basic knowledge purposes. So in this case, if I want to check for left lateral flexion, I need to be on the right side of the client. So I'm going to be pushing down, don't let me move you. 5, 4, 3, 2, 1. So the power is coming from here, pushing down, just like the passive, but it's opposite this time. So for right lateral flexion, I'm going to be here, pushing down, and don't let me move you. 5, 4, 3, 2, 1. Relax. Excellent. Any pain?
No.
Okay. So for rotational component, again, same idea. I'm going to try to turn her. So if I turn her to the left and I'm holding, which direction am I testing? Not really. We can tell until we test, right? So let's go. Okay, I'm going to push this way, turn it that way. Don't let me move you. Hold. 5, 4, 3, 2, 1. So if I'm trying to test for the right rotation, I need to be on the left. Okay? Same idea. Don't remove you. 5, 4, 3, 2, 1. And relax. Perfect. Now the power is coming from my forearm, not from my hand. I'm not trying to pull her shoulder because that will drag tissue away and might not be actually comprehensive. So I'm basically trying to use my forearm pushing into her shoulder on the side of the testing, and I'm trying to turn her into right, which she's testing left. Okay? So when it comes to that, you ask for the pain, and that will conclude the 6 motions that is involved in the thoracic spine and lumbar spine.